And I'm going to answer some of the CO2 laser resurfacing questions. There are a lot of them. Still the gold standard. All other devices just try to acquire the improvements that you can get with fractional CO2 lasering in terms of skin tightening, sun damage, fine lines, wrinkles, scarring. It is still the gold standard. There are pros and cons, and we're going to go through them in a second, so check it. Can the skin turn white? This was a rare complication of much older technologies, both phenol chemical peels from the 1980s and continuous wave CO2 lasers. It does not happen with fractional CO2. Fractional CO2 is amazing for skin tightening. Not deep skin tightening like a facelift, but superficial skin tightening. Crepey skin, irregular texture on contours. It really does pull the sheet from the corner. Red. Your neck looks very red after the treatment. The magic question always comes up. It really depends. You know, a scar, surgical scar can be several $100s a treatment. Full face and neck could be upwards of $10,000. It really depends on what we're looking to accomplish. Other areas. You can use it selectively on the body, very cautiously, mostly for scars. Do use it sometimes on the chest, but you do have to be cautious with CO2 laser resurfacing on body parts because of the extended recovery involved. How often? How about once? There's no other treatment that accomplishes so much in just one treatment than fractional CO2 laser resurfacing. There are patients that need a second treatment, but it is not common. One and done. Results are permanent. How often do you hear that? Now, you may age out of it. I've been resurfacing skin for 20 years. People definitely come back because you can't stop time. But CO2 laser resurfacing, it really lasts. There should be no scabbing. Not with modern day resurfacing. You do have a little bit of oozing or bleeding for about 24 hours, and then you're really just swollen. If you don't cause bleeding, you're not going deep enough. Morpheus A or any other energy delivered microneedling is just not going to compare. You would need multiple treatments. You can get similar type of improvement, but nowhere to the extent of what you're going to get to fractional CO2. Well, if you do need or want more than one treatment, you really want to wait 3 to 6 months because there's an enormous healing response that takes place even once you've healed. So I would say about 3 months. Rosacea. Well, we use fractional CO2 for rhinophyma and to even out bulbous nose and tissue that can occur from sebaceous growth from rosacea. But you do have to be careful about persistent redness or exacerbating. Dark skin. You have to be careful with very dark skin. A lot of patients who have darker skin tones, African American, Hispanic, Middle Eastern, Indian, they tend not to have the same problems that require it, so it doesn't really come up much. Strict sun avoidance for 1 month. Definitely a month. You can be a little sensitive, a lot sensitive. What is Twilight? Twilight is the type of anesthesia that you get when you get a colonoscopy. It's not general anesthesia. You are somewhat arousable but asleep, and it is what is required to truly do fractional CO2 laser resurfacing the way it should be done. If you can tolerate it awake, it's not. In my opinion, the way to do this procedure is asleep, so there is no pain. Nerve block, shots, topical, waste of time. You're not going deep enough otherwise. There is pain for about a half hour when you wake up, but none during the week-long recovery that you're at home. You cannot use makeup during the recovery. And this is the major difference between Fraxel Dual or other resurfacing devices. You are really at home. You have to protect yourself from the elements. I tell people you could put on makeup at 1 week, and then you're a little red and sensitive for 1 additional. In general, it is not going to affect your injectables. In fine-lined, thin-skinned areas like under the eye and the upper lip, it can remove some fillers superficially. Usually you can re-inject at 1 month. Recovery time and fully ablative versus partially ablative. It is 1 week of downtime at home. It is an additional week of a little bit of puffiness and redness with makeup. You should be ready for a great party at 1 month. Can you be too young? Well, we use fractional CO2, the Fraxel Repair, on often young children with burns or scars. You could do fractional CO2. There's no limit. You just have to use it for the indication that is appropriate. This is a patient who had clogged pores or acne after CO2 lasering. You can get acne breakouts or clogged pores after any laser procedure or other device. People that are acne prone, there are tricks and medications we have to beat it at the path. Is it suitable for Asian skin types? It depends on how dark the skin type is. It's not an ethnic thing, it's just a skin coloring thing. And people that may have issues with hyperpigmentation or hypopigmentation, there are some preventative measures that we... Sores. This is probably the number one complication that you have to prevent. I've never seen it because everybody, 100% of people, regardless of whether you've had cold sores or not, must go on a week of Valtrex or recyclable. Antibiotic cream. No, you are using acetic acid soaks, vinegar water soaks for about 24 hours, then Aquaphor, Vaseline for about 4 days, and then like a thick CeraVe, something like that. You do go on a few days of oral antibiotics. This is not a treatment for melasma. There are much better devices and topicals for melasma. I would consider it high risk for CO2 laser resurfacing. Actually, the less invasive fractional technologies do great. So, for surgical scars, I really like to V-beam surgical scars immediately to get the red out. Once I feel like it is totally healed, that could be at a month, 3 months, 6 months. If it doesn't heal right, I'll consider CO2. Face tight. Face tight is more for fat removal and deeper skin lifting. I will sometimes CO2 over that, which is more for fine texture, lines, crosshatch skin. They could work well together. Yes, you can do some areas of the face and not others, like around the eyes, and then you could do a light fractional resurfacing, non-ablative elsewhere, and this will prevent you from having to go under anesthesia. That you can do it in. Can you ever lay in the sun? I don't know. Would you? I mean, you're very sensitive for several weeks. You could certainly be outdoors and protect yourself, but if you're spending thousands of dollars to resurface your skin, do you really want to lay in the sun and try and get tan? All right, friends, that about does it for Dermatology Question Couch Fractional Resurfacing Miami edition. Still a great procedure, well over a decade. Best to be put to sleep. 1 week downtime at home. You're ready for a major party at 1 month looking great because it is still the facelift of the skin, and everything else is trying to compare to that. So I'm going to go back to the frigid weather of Miami. It's not New York, but it's pretty damn good. See you later.